So it was hard. It was hard because, of course, scared as a one person. I was the first day I was there, I was just me. You want the client to trust you. And at VetLife, we aimed for the pet to have a good experience.
Hello and welcome back to Career Talks. My name is Muzammil Altaf, and here we are joined by Dr. Toshan today on episode 10 of Career Talks. A little bit about Dr. Toshan. Dr. Toshan is a veterinary graduate from Malaysia who has recently opened up his own veterinary clinic. And today we're going to talk to him, listen to his life stories of how he opened this vet clinic, how he went to vet school, and so on and so forth. So without further ado, let me introduce to you Dr. Toshan. Dr. Toshan, why don't you tell us a little bit about yourself?
Yes, hi, Muzi. So basically, my name is Dr. Toshan Ramlochan. I'm from Mauritius. So I was born here and raised here. I did primary and secondary school here, and for my tertiary studies, which is veterinary medicine, I did in University Putra, Malaysia, which is in Malaysia. Okay, together with you, my dear friend, right?
So let us talk to you about your life in high school. What kind of subjects did you take? And how did you decide that you wanted to pursue a degree in veterinary medicine?
Okay, so I always wanted to do science in school. I was always interested and passionate about science. And on my final 2 years, which is A levels, Cambridge, I did mathematics, chemistry, and physics as my main subjects. And yeah, I finished my A levels pretty good. But then after that, about my career choice, I was a bit confused. I didn't really wanted to do, I didn't really know what to do. Unlike a lot of people, um, a lot of vets out there, being a veterinarian, it was a childhood dream. For me, it was something I found it along the way. So basically, after my high school, I was trying to go and see options. For example, I had one option to go and study nanotechnology and to be a research scientist. But then that pathway seems to be very vague pathway for me. And then there was my dogs. I used to bring them to the vets, and I saw, hey, there's vets out there. There's something called the vet. There's a job called a veterinarian out there. So why not me try that? And I asked advice and asked people around the veterinary world what they advise. And then I got pretty good feedback. And then finally, I had to I decided to study veterinary medicine.
That's
Yeah.
pretty interesting. So let's talk about your life in vet school. How was the whole course, the veterinary medicine, and what kind of things did you do in it? Was it mostly theory or was it mostly practical?
Okay. So my life in vet school. Okay. My life and experiences in vet school. Okay. Once you go into vet school, you have to know that it's a lot of hard work. It's a lot of sacrifice. In general, it's a good experience being out there in Malaysia studying. It's a very good experience. It's a very positive, rewarding experience. You get to learn, you get to work and be independent. But of course, you'll have to do a sacrifice. It's a lot of hard work. You have to get used to the country. You have to get used to the country's food. You can have language barriers as issues, and you will feel homesick. So going to vet school, you have to know that at the end of the vet school, you're going to be a doctor, and it's going to be worth the effort, it's going to be worth the pain, it's going to be worth the sacrifice. And you were telling me about the degree, right?
Yeah,
So about the degree, of course, it's lots of hard work, a lot of time you have to put in to be a veterinary medicine doctor. Okay, so basically, the degree is divided into three parts. You have the clinical, paraclinical, and you have the preclinical, paraclinical, and clinical part. The preclinical part is mostly and paraclinical part is mostly theory. So you learn about basic things about what is normal, for example, the normal anatomy, the physiology, which means the normal functioning of the body. Okay, and then the second part will be paraclinical, whereby you learn about disease, how a disease is caused, bacteria or virus. And finally, the clinical part is where you go and actually do hands-on experience in the hospital, in the equine unit, in the farm. Okay, and throughout these years, you do have internships. You do have internships whereby you go and learn during your semester break and you volunteer to see how work is being done. But it's get the hands-on thing and the experience and thing is more intensive towards the end of the degree. Initial part is mostly theory, and then you get to go for internship in your semester breaks. Yeah.
That's interesting. So it's basically a very packed course. You have a lot of theory and you also have a lot of practical experience. Going on from vet school to your vet life, for example, your first few years of experience, what kind of things were you doing there?
So basically, after veterinary school, I came back to Mauritius because it was during COVID times, and from here started work with one of my senior, which was also a student of UPM. I did 6 months with her. I learned basic things about diseases, common diseases in Mauritius, and medication that we use in Mauritius, and got a basic knowledge of stuff here. And then from here, I moved to a big hospital in Mauritius called Animalia, whereby there I got good experience, good exposure about diseases, and also good training from foreign, well experienced vets. So in Animalia, I did around 1.5 years. And then from there, I move on to join an NGO called All Life Matters in Mauritius. So All Life Matters, I use my experience, which I got from my previous job, to diagnose and help in treatment. But what I learned at All Life Matters, and I got to do a lot of surgeries, because All Life Matters is an NGO focused in sterilization, the spaying and neutering of animals. Why? Because in Mauritius, we have a big issue of stray dogs or in stray cats. So that's what we were doing every day. That's where I got to broaden my skills, my surgical skills, and got myself really, really good in surgery, which is especially sterilization, spaying and neutering of dogs and cats. And I was doing around 15 to 20 surgery per day there, and I did almost 1 year there. So around this 1 year, you can say I did around 5,000 surgeries for dog for spaying and neutering. And right now, I'm pretty confident with the surgery, and I'm actually good with it. I know the I know I know how to do things. I know if things go bad, what to do. Okay. So why I did so much surgeries? Because in Mauritius you have this big issue, and if you want to be a good veterinarian in Mauritius, if you want to contribute for the animal welfare in Mauritius, you have to be a good doctor. You have to be able to do this basic sterilization surgery. This is one way of helping the community back, because you don't want so many strays, you don't want so many sufferings. Yeah. And then after All Life Matters, I open Vet Life, which is my new clinic.
Okay, so basically, you had a couple of years after you graduated to build up your own confidence, build up your surgical skills, build up your diagnostic skills, so that one day you can open your own clinic, which is the next question. You opened a clinic called Vet Life. Why don't you tell us a little bit about how you got the idea to open a vet life, and what was the motivation behind you opening your own vet clinic?
Okay. So going to vet school, I always wanted to have my own clinic. Okay, that was an aim, that was a dream. Many of my close friends know that. And why? One of the reasons why is because uh, I saw my parents I saw my parents, they were struggling a lot when they were working for other companies and all. But once they opened their own shop, um, they were able to actually sustain my education through their own small shops, through so small, through their own small business. And I was like, yeah, if I'm gonna be a doctor, I'm gonna open my own clinic because this is what helped my parents pay for my studies. They did their own business, and for me also, I wanted to run my own business and be my own boss. Okay, so yeah, what's your next question?
So basically, your motivation behind it was that you needed to be your own boss. You needed to be your own self-employed. You need to do work on your own business. How did you come around the idea of wet life? How did you name the clinic? How did you go around choosing the right location, choosing the right kind of? How did you get along the equipment? And of course, how did you start something like that from scratch?
Okay, okay. So once I was at All Life Matters, I knew I wanted to open my own clinic. Okay, and of course, there's this big hesitation that I had, and I think a lot of people will have before studying their own clinic. And with a push, with a little push from my family, and of course, with a little of motivation from myself, I say, okay, now I have the necessary skills. I know how to diagnose, I know how to treat, I know how to do basic surgeries. Of course, there's still room for so much improvement, but if I wanted to start it, I have to step in, I have to start. If not, you will always be hesitating, you will never start. Okay. And then from there, I was like, let's find a location for my clinic. And it's important for people who listen to us and for future business owners to find a proper location for the clinic. So it should be a place where there is a demand for a vet to be there. If it should be a place, we should choose a place where there's no competition, very close to you. Okay, this will make your success rate higher. Okay, it should be a place on the ground floor because if you're opening a place on the second floor, it's going to be hard for big dogs to come unless if you want to just do a cat practice. But if you do a mixed practice, ground floor is good, good parking space is good, and close to the main road, whereby you can easily explain on the phone in 2 lines where are you situated. Okay, so once you get a place like this, you rent. I got a place. I took this place as I rented. I got it from rent. I'm renting it this place. Okay, and then from there, it was just a rectangular space. Okay, it's a small space, a rectangular space, and then from there I had to start doing the planning of using pen and paper, start drawing the lines of where I want the partitions to be. Like right now, I have reception. I just have a reception. I just have a consultation and a surgical room. All of them are very small, and they are divided by aluminium boards. Okay, so this is one of the things that I do. And in terms you asked me about the name also, how did I come about the name? So it was hard. It was hard because I didn't have any name during vet school, and I didn't have any name during vet school. So I was just looking around possibilities, what possibilities I can find about the name. What I wanted to know, what I knew it should be small name. It should be a name where you can easily pronounce and not difficult. It should be something easy. If it's a long name, people will not remember. Okay. So after a few trials, I finally got vet life, and I was like, yeah, that sounds good. That sounds small. It has vet in it, which is vet means veterinary, and life, which is basically it's a life-saving service, and you're saving lives. So vet life sounds great. No one has this name here. Why not I choose this name? So this is one of the things. Yes, and then coming to the logo, getting a logo was not an easy thing to do. So I hired a graphic designer, and then I had to guide the graphic designer step by step of how I want the logo. Okay, I didn't have a specific idea about the logo. I'm not an artist, but he gave me a few ideas, and from there I tried to improve and improve and improve. And one thing you have to know is no one knows their job so much, and no one really knows how to do stuff. You have to sit with them and guide with them so that they can deliver what you really want. So getting the logo also was not easy for me. It took lots of days of work, and
What kind of difficulties did you face when you were starting your clinic? For example, your licensing, your documentation, the laws that you require. So, what were there any more difficulties that you don't see when you have the idea, but once you start building a clinic, you will start facing them one by one?
okay, so once basically as you're starting, of course you're starting from scratch. Your location is something that you're renting, so you have to make you have to accommodate your own you have to accommodate yourself in that space. So you have to plan according to that space. You're limited there. You're not you're not building something out of land, and then it's already pre-planned. Now you just have the space. You have to compartmentalize the space. So basically planning where to put the separation of the walls is one of the difficulties which I had, and which require proper planning and proper measuring. Second is, of course, the name and the logo, which through time I was able to get it. And then actually opening the clinic, in terms of difficulties, you will have financial difficulties, of course, because it requires equipments. You have to build stuff. You have the I have for me I had the partition of the walls. I have to get new tables. I have to get cupboards, surgical table, and new shelf and reception table. So the financial recoveries is here, but it's worth it because once you start working, those those costs you will easily cover them. Okay, and yeah, next.
Okay, so now let's talk more about what kind of procedures you're performing currently at the clinic, and what kind of staff did you start hiring once you open the clinic?
Okay, so once you start the clinic, it's important that for me, I started the clinic small, okay, because I'm just a one. I started it as a one person. I was the first day I was there was just me, and I started the clinic small, and because I didn't have big experience with business, and I was of course scared, and I was hesitating to open a big business. So for me, I've started small. I had my own consult, and what I started doing is, of course, I started doing basic things like vaccination. I saw diseases, parvo cases, all those diseases comes to me. Then procedure, I started doing sterilization, of course, and then slowly increasing to hernia surgeries, removal of tumor surgeries. So, and now we are just doing all soft tissue surgeries. We're treating all kind of diseases. We're just not doing orthopedic surgery now, but we plan to do that in the future. Yeah.
Uh-huh. So, what's your goal for Wet Life to be in, let's say, 5 years' time? Where do you see Wet Life growing up to be?
Okay. So I started VetLife. I started VetLife because I wanted to run my own clinic, and I wanted to add my own personal touch in the clinic. Okay. My aim for VetLife is to give a very good quality care of veterinary medicine in Mauritius, because here the veterinary medicine is still it's still very basic. Okay. and I want to improve and give a good quality care for our animals here, because people actually want to take care for their animals now. And we I could see a transition long time ago. People was not caring so much. Now their pet is their children, and they will do everything for the pet to be healthy, for the pet to be back to normal from a sickness. Okay, so my short-term goal and my long-term goal. So basically, my short-term goal right now is to hire proper staff. Okay, because I want to retain my staff. I want to train my staff for them to be good, because alone I can't do everything. I need good staff. I need good staff to be able to explain to client about diseases, to explain to client how to give medication and to give advice to the client. So a lot short-term goal is a lot of preparation, a lot of time is being given for training of their staff so that they have a good knowledge and also they're happy to come to work. And a happy staff means a staff who will deliver a good quality service. Giving good quality service is very important because you want the client to trust you, you want the client to retain, you want to retain the client. Okay. Next will be the future goals for the clinic. The future goals is to get blood machines, to get an echo machine, and of course to work towards animals, and also to work towards a clinic whereby when animal comes to the clinic, they have a good experience. I always want vet life to be like this. We are already practicing this. For example, when the animal come, for example, a dog coming for vaccination, you give them a treat. Okay, you give them a treat. You give them some cuddles, some kisses, so that they are happy to come to the vet. Okay, I've heard a lot of stories whereby you have dogs and animals whereby the client complained that at the other vet they got injection and they were holding the pet in an aggressive way. The pet got traumatized. And at vet life we aimed for the pet to have a good experience so that they're happy to come, and also if the pet is happy to come at the clinic, the client also is happy to bring their pet to the clinic. So we try a maximum for them to have a good experience. And in the future, what I wish to do once I have more space is to separate dogs and cats, because when cats smell dog, they get more stress. And to use special things, for example, pheromones like Feliway for cats and Adaptil for dogs. And these, once you put them in the room, the cats will be more relaxed, the dogs will be more relaxed, and then and then and then this will make my job as a veterinarian easier, because the cats and dogs will be more cooperative. Okay, and then
That's amazing.
for the long-term goals, basically will be to get a bigger place, and to get more doctors working for me, and to get this vet life a big company whereby we treat all type of diseases, we do all type of surgeries, and it give and improve the quality of care that we have in Mauritius. Yeah, thank you.
That's amazing. As always, I wish the very best for Vet Life. I hope we see the growth that you want to see. I hope we see the growth more than what you want to wish for. Now, obviously, before we end in a few minutes, I would like to get a piece of advice for you, for the young businessmen who are about to open a vet clinic. What kind of advice would you have for them? Just a short piece of advice.
Okay, so first thing will be, do not hesitate to start. Okay, one of the big hurdles about starting something will be is a hesitation, because you go out from school, you ready to be a vet. The school trains you to be a vet. School doesn't train you to open your practice. Okay, so once you know you have enough skills, enough basic skills. I said basic, why? Because you don't need to be a specialist to open your clinic. You need to be basic. Okay, so once you're ready for that, don't hesitate. Just step into it and start doing step at a step by step, one at a time. Start small, and you will find growth. Okay, unless you have a good mentor, you have few people with you, you can start big. But if you're alone, start small. You can do this. Veterinary medicine, veterinary clinics, or something that never fails, because animals always need care. And if you can provide a good service, you can provide quality care, and the client can trust you, of course you will succeed. And no one, I don't know anyone who fails. So just start doing it. Don't skip this hesitation, skip this fear. Start small, step by step, you will achieve success. You can do this. Yeah.
That's amazing piece of advice for anyone out there who is listening until the end. Well, Dr. Toshan, I would like to appreciate your time. I'm very grateful for your insight into how you opened VetLife, your veterinary clinic in Mauritius. I hope the very best for your clinic. I hope that whoever is listening gets some motivation from you, and also some insight of what they need to know before they embark on their own journey of opening a business. I would just like to end this by thanking you once again for your time. And I hope everyone who is listening found this very useful.
Yeah.
And until next time, uh, obviously, I wish you all the best, Dr. Toshan, once again. Everyone else, you remember to comment and ask any questions you have to Dr. Toshan in the comments below. And I will also leave you his email and also a link to his veterinary clinics page, so you can check out his veterinary clinic as well. And obviously, thank you so much, and
But
have a great day ahead.
yeah, bye.